We've been discussing external tibial rotation, and it's a reason and oftentimes an under looked at issue going on for a lot of people with foot, ankle, knee, hip, and low back issues. So like I said, it's kind of recap, or if you haven't seen our last videos, external tibial torsion refers to the lower leg bones. For some individuals, most individuals, your leg bones are normal and you don't have this issue. Like I said, so if we find the center of our kneecaps and we drop a plumb line straight down from the kneecap, that should sit right between our first and second toe. For the individuals with external tibial torsion, that plumb line is going to drop down to the inside of the foot. So it's going to drop towards the middle, the medial side, the midline, wherever you want to call that. So, and like I said, or like we've discussed in previous posts, it's also can be on one knee, it can be on both knees, it can be on both sides, and a little bit more increased on one side than the other. So it might be a slightly different rotation than on the other side as well. There's many times a genetic component, but today we're going to discuss what do we actually do, or what's some long-term strategies to keep this from actually becoming an issue, or how do we make ourselves more resilient? Because we also know in the rehab world that once you've had an issue, there's a good chance you might have that issue down the road again. So one of the strategies what we like to think that might help is keeping that area of the affected area strong. So what that looks at on the rehab side of things, we look at the individual and we figure out, is this more of a, if they're having hip issues, we're going to work more on the hip. We're going to work on a little bit of mobility. We're going to work on some stability of the hip. We're going to work on some strength of the hip. If this is a knee issue, we're going to make sure that the knee's doing okay. It's not injured. There's no ligament issues. We don't need to worry about sending them off for anything. If it's a foot issue, we're going to look at the exact same thing. We're going to look at some calf and foot strength exercises. We're going to look at some mobility things. We're going to look at changing up the mechanics of how they run. We're going to discuss footwear. We're going to discuss how are you walking or running with your feet. For a lot of these individuals, we need to be walking and exercising with a toed out gait, not a toe straight ahead. Toes need to be turned out just a little bit so the kneecaps are staying straight ahead and the pointing to the front of us. So there's a lot of different avenues we can go, but really finding a good practitioner who kind of understands what's going on is key. If you don't have a good practitioner, I do want to give a shout out to one of my good friends and mentors, Tom Bashad, picking up his book. This is written for everyone, Injury-Free Running. Humanlocomotion.org is his website, and if you've been to our clinic, we use a lot of his products for foot, ankle, and lower extremity stuff. So shout out to Tom. Thank you so much for this book. I love reading through this book. I pick it up almost every single time someone comes in with one of those issues, just to kind of make sure that we look at the right stuff and we make sure that we get the right things and the right exercises in place. So definitely check this out at humanlocomotion.org. If you're in Kansas City, we'd love to work with you and take a look at what's going on. You can also feel free to reach out to us or leave a comment down below.